Hi, I'm LaVonne Rembert, and I'm a patient at UF Health. I'm an Ironman triathlete, so I was in training for my next race, and I went out to go run, and I started having some issues and not able to do my workouts. And so one day I got up to go out and run, and I wasn't able to go at all. You know, most runners get some kind of aches and pains, and we push through them, and that's kind of what I did for about a month.
LaVonne came into us in September with progressive hip pain. And in somebody like LaVonne, who had done multiple Ironman 50-kilometer races and marathons, what changed in her regimen? How does it hurt? And you look for pattern recognition.
So I learned that I had a basicervical stress fracture on my femoral neck, which wasn't good and put my training to a halt. So that was when I first had my experience at UF Health.
And when you're treating somebody like LaVonne, who is very ingrained with exercise, and it's her daily life and it's part of her identity, you have to approach that very carefully. And I think what helped us is by being in the community and being at races with everybody and being part of what goes on, there was a trust factor.
The first couple weeks, I was really sad. I'm a super happy person, and I had a hard time for a couple weeks not being able to do anything. I couldn't swim, I couldn't bike, I couldn't run. In November of last year, I started doing physical therapy for about a month, and he cleared me to run. So I was able to start back running in January, and I've actually signed up for my next Ironman that I'm in training for, which is in about 24 weeks.
LaVonne Rembert is one of the people who brings sort of light and sunshine to the world and to your life. I think of her as a person that you're better off by knowing her. I do have patients come a long way because I, quote unquote, think differently, is what they tell me, but this system allowed me to do that. I didn't fit into a cog in a wheel. I was able to make my own. At the end of this, we're gonna get you through it. You're gonna be better when you're done, and they just have that faith that they're gonna go along with us.
They find the best treatment option for each of their patients and get you healed and back to where you wanna be, which is the ultimate goal.